All right, so we up to our next discussion here, and for this, we're talking about the morphology of Hirschsprung's disease. Morphology of Hirschsprung's disease. So, for the morphology of Hirschsprung's disease, it just has to do with this enlargement of the intestines. All right. So morphology is more of like how it will look like, the physical characteristics. So let's quickly have a recap of the pathogenesis. So first of all, it's a disease condition that usually results from the failure of neural crest cells to migrate completely into the distal colon. That's when the baby is developing. All right. So this will now lead to the absence of ganglion cells in both the submucosal side and also the myenteric side. So because there is no nerves, the segment cannot relax. Do you understand? So most of the times there's dilation and that part of the stomach can't really move like it used to. Okay. So gross morphology, aganglionic segmentation. So it mostly often involves the rectum and the sigmoid colon, and it appears narrow and contracted due to tonic contractions. Okay, so this leads to absence of ganglion cell. Okay, no. Then the proximal colon, because the rectum down is contracted, the one up is usually so big. The down is contracted while the up is very big. Do you understand? It can extend many centimeters or even meters above the affected segment. So transition zone is a sharp demarcation between the narrow distal aganglionic segment and the up part, which is dilated. So microscopically, morphology, there's absence of ganglion cells in the submucosal and the myenteric plexus. Then hypertrophy of nerve trunks in the submucosa. Then there's increased acetylcholine series activity in the nerve fibers. Then that's the aganglionic side. Then for the dilated side, it could lead to inflammation, it could lead to ulcerations, and sometimes ischemia, okay, due to stasis.